Welcome to IGC's first remote interview. My name is Shahid Vaziralli. I'm the head of the research program here at the International Growth Center. So today I'm joined by a very special guest. Jean Drèze is a Belgian-born Indian development economist, been a highly influential figure in the shaping of economic policy in India. He's taught at the London School of Economics and at the Delhi School of Economics, and is currently visiting professor at Ranchi University as well as honorary professor at Delhi School of Economics. So his work in India covers issues like social inequality, child nutrition, healthcare, and food security, and is, of course, co-authored with Amartya Sen on so many well-known publications. So Jean Drèze, welcome, and thank you for accepting our invitation.
Thank you.
So I'll start with a question on the Indian response to COVID-19. So the pandemic is obviously, a once-in-a-lifetime type of crisis, potentially catastrophic consequences to health and livelihoods. And now we see that there's some evidence to suggest that the public sees the pandemic as possibly a greater threat to the economy than to their health. And similarly, economists around the world, including us at the IGC, have advised governments from developing nations to carefully weigh the costs and the benefits of government-enforced shutdowns. So reflecting on India's case, what government responses to fighting COVID-19 have been appropriate and timely, and what do you think should have been done differently?
Well, first of all, to clarify, Shahid, you said something about a potential catastrophe. Now, I think we have to distinguish here between the health catastrophe and the economic and humanitarian catastrophe. The humanitarian catastrophe is not a potential catastrophe, it's already happening, with huge numbers of people being thrown out of work and having no means of subsistence for a long period of time. The health crisis is a potential catastrophe because the numbers are still quite low. I mean, especially compared to the huge numbers of deaths every year from TB, malaria, dengue, chikungunya, and of course, undernutrition. Now, that's not to deny that there isn't a health crisis. It's true that things could get very bad. But we are basically trading now this safety from a potential health crisis against a very real immediate humanitarian catastrophe. And so coming to your question, I think that what could have been done differently at every step is to pay more attention to the human consequences of this very harsh lockdown in India, and especially the consequences for poor people. Now, of course, it's a chronic problem in public policy in India that the poor don't count for very little, because basically poor people don't have any significant access to any of the democratic institutions, whether it's the court or the media or anything, except to some extent voting. That's the only thing they have, and even that for many people is a bit of a shot in the dark. But anyway, it does give them some sort of bargaining power. But otherwise, they are basically out of the game of public policy, and that's why it can be so neglected. And we see that reflected in this crisis in so many ways. The most dramatic and best known way, of course, is the way in which the migrant workers were ignored for a long time, and the trains and buses and all public transport all this was cancelled overnight, even less than overnight, in fact. And huge numbers, tens of millions of people were suddenly stranded thousands of kilometers from their homes without a job, sometimes without a place to stay, without any assistance. Really a dramatic attack on their livelihood. And it took quite a while for the governments to wake up to this. So had that been anticipated, a lot could have been done actually to make life easier for these people, even if you feel that they could not have been allowed to return in a hurry. Yeah, even if you feel that they had to stay in place. I mean, there are all kinds of unused resources in this situation, like empty buildings, museums. There are huge food grains reserves, as you know. There are public employees who don't have much to do because right now they are out of a job. So all kinds of resources could have been used to provide at least basic shelter and relief to these people. And there are other manifestations of this problem. For example, the lack of any kind of advanced relief plan at the time when the lockdown was imposed, the way all kinds of essential services were discontinued without batting an eyelid, including even things like child immunization, outpatient departments in the health centers, employment guarantee work sites, all sorts of things that are very important for poor people. And then, of course, there's also, for many people, the police brutality in enforcing the lockdown. So what you see is a pattern at every step of double standards and of the poor being badly treated. I think that is really what should have been done differently.
Yeah. So I read a piece by you recently in the, I think it was the Indian Express, where you were talking about India's very large food surplus.
Right.
I wasn't aware of that. The fact that the center is not releasing food to states adequately, and it could be an issue of food accounting. Now, could you elaborate on that a little bit?
Okay. So India has an extensive system of subsidized food rations. 2/3 of the population, that's 800 million people, in fact, a little more than that, 75% of the population in rural areas and 50% in urban areas. And that system of public distribution is actually saving huge numbers of people right now. But of course, many people are excluded from it because about 500 million people don't have a ration card. And that includes many poor people or people who normally would not be poor, but now have been pushed into poverty by the lockdown and unemployment. So in the meantime, the government has these, the central government rather, has these humongous food grain reserves, more than 70 million tons, and growing now as the procurement for the Rabi harvest proceeds. So they're going to be even more, probably more than 80 million tons by the end of June. And to be fair, the central government took one measure, which I think was very commendable, and that was to double food rations under the public distribution system for 3 months, for an initial period of 6 months in April, May, June. I think that was a very good move. It also added lentils to the food rations. But what it did not do is to release more food stocks so that those who are out of the system could be covered. And that could be done very easily with a fraction of the excess stocks. I mean, if you wanted to universalize the system of food rations in rural areas and urban slums, which I think is a very important and urgent thing to do, that would require barely 20 million tons of food grain for a year, which is less than half of the excess food grain stocks. So I think something there has been lacking. And you mentioned the accounting issue. Indeed, there is an accounting issue, which is that the food subsidy, of course, there's a big food subsidy behind all this. It costs quite a lot, like 1% of GDP. But I do think it's really worth it. But the problem is that the food subsidy gets counted at the point when the food grain stocks are released, which is actually not very logical, because when you release surplus stocks, in economic terms, there's no real cost, but in accounting terms, it's actually quite expensive. And that's one reason why the central government is reluctant to release more stocks. And I think the other reason is a kind of chicken game between the state governments and the central government. The central government is trying to force them to pay more than 20 rupees a kilo for getting more food grain, which is almost the market price. Whereas the state governments are trying to put their foot down and say, no, you should give it to us for free. So there's a kind of stalemate there that should give in and agree to give the food grain stocks for free.
That's really interesting and informative. So going back to the problem of migrant laborers, you obviously mentioned that 500 million people are without a ration card. Many of them are migrant laborers. It's going to be very, very difficult to target these people. And of course, India should be looking beyond targeting and making it more universal. Just a couple of figures that I've come across. So one is, I read that more than 40 million migrant laborers across the country have been stranded by the lockdown. That is a huge number. I don't know whether that's factually accurate or not. And then, of course, new research by the Center for Monitoring the Indian Economy, the think tank, has shown that 120 million Indians have lost their jobs. Majority of them small traders or migrant workers. So beyond the PDS, which obviously has its issues, and you're advocating for increasing the supply from center to the states and just increasing the supply of food in general, what more can the Indian government do realistically at this point in time to kind of extend social protection to these groups of people, migrants and informal workers, many of whom may fall by the wayside of the COVID relief program.
Right. So you mentioned 40 million stranded workers. I'm not sure what the source of the figure is, but basically it has to be some kind of guesstimate, because I don't think that there's any reliable source of information on this. But we do know that it's in tens of millions. And even that is a fraction of the entire problem, because the stranded migrant workers, in a way, are the visible face of the problem. They are there on the computer, on the TV screens. We can see them struggling to go home, sometimes cycling or even walking thousands of kilometers. And obviously, it moves people for very good reasons. But then there are many more who may be even worse off, or at least as badly off, and are invisible, starting with the families of these migrant workers. Many of these migrant workers are young men. So many of the migrant families would be young women with children, sometimes also taking care of the elderly, and subsisting to a large extent in normal times from the remittances of these male migrant workers. And now they're at home without the remittances, very often without a ration card, because those that don't have ration cards very often are young couples who married after the ration cards were distributed. So these women, you can imagine their condition without remittances, without ration cards, and without any idea of how long it's going to take for things to improve. And then there are many other people who may not be part of migrant families or may not be migrant workers, but are simply people who live in poverty, who live in particular from local casual labor, and again are being thrown out of work. So coming to your question, what can we do? I think one very big part of the answer, which fortunately is happening to a significant extent, is the public distribution system, which I believe could be consolidated and expanded further using these enormous food stocks. Secondly, I think it's very urgent to expand employment under the National Rural Employment Guarantee Act immediately in the next couple of months, starting right now, because the most difficult time of the year for many people in India, and especially in North India, is the monsoon, which is going to start in less than 2 months. Because even in normal years, most people are not able to get any employment during the monsoon, so they cultivate their crops and they try to survive somehow through the season. So it's very important before that to generate large-scale employment so that people have some reserves before the monsoon starts. Thirdly, another category of very vulnerable people that very few people talk about somehow is the elderly. They are the most vulnerable to the health crisis. Some of them are among the poorest, old people who live on their own, widows, dependents of poor families. And there are, in most states of India, social security pension schemes for these people that could again be consolidated and expanded at short notice to help this very large group of vulnerable people. Vulnerable also because in a time of crisis, what tends to happen within the family is that people protect the children, and the women very often sacrifice themselves to some extent, but the elderly in particular tend to be neglected. So it's very important to, I think, do something to assist them, and social security pensions is the easiest and the most natural way to do it. And finally, I would say that whatever you do about these three very major programs, PDS, the Public Distribution System, the Employment Guarantee Act, and social security pensions, there will still be significant numbers of people who fall through the cracks and are vulnerable to hunger. And for these people, you need a kind of emergency facility, like a local community kitchen in the village, where anyone who is hungry can just go and have a meal. And again, it's not that difficult to organize because there's a very functional school meal program in every school in India, every government school, I should say. And there are also feeding programs in the childcare centers called Anganwadis. So it will be quite easy to add a kind of relief component to these programs so that anyone who is at risk of hunger can go and have a good meal. So I do think that India has some foundational social security program that could be used with good effect in this crisis to protect people at least from destitution and hunger. But it does require quick action and a fair amount of money, and that has to come primarily from the central government, because only the central government has access to the resources that are required.
Be especially tragic in a case like India's, where the infrastructure exists and the resources by and large do exist, for it not to happen, right? If you compare India to some of the other African countries, at least we have a PDS that sort of works, you know.
Yes.
We have many social security programs in place. Of course, they all have their problems, but by and large, they do seem to work to some degree, and not buffering them and expanding them would be quite a tragic mistake. And finally, just thinking beyond the current crisis, which is hard to do, obviously, because we're kind of mired in the crisis right now. What do you think should be the kind of key economic policy priorities for a post-COVID crisis India? So how do we get back on our feet, you know, and how can we ensure that this sort of human tragedy does not occur again?
Well, I think that one has to consolidate these foundations that I've talked about of social security, and also, very importantly, of the healthcare system. India is paying a very big price now for underinvestment in the healthcare system for decades. I mean, to this day, the level of public expenditure on healthcare as a proportion of GDP in India is barely 1%. It's been about 1% for at least 30 years, which is one of the lowest levels in the world compared to let's say 6, 7, 8% of a much larger GDP in almost all the OECD countries except the US. So I think that there has to be a much greater investment in healthcare, and a decisive move towards the principle of universal healthcare. That is, that healthcare is primarily a social responsibility. It's not a fit subject for private profit. And if somebody is sick, then we take care of them, whatever is their ability to pay. That is the basic principle of healthcare now in quite a large number of countries, including countries not far from India, like Thailand and Sri Lanka. So if those countries can establish that kind of healthcare system, then I'm sure that India can do it as well. And I would say beyond that, it's not just healthcare. I think there is a huge tragedy in India of waste of human resources, partly because people are not in good health, but also undernourished and getting very little school education, very little social security facilities. And that is what is creating this huge reserve army of labor today that is marooned in the informal sector, working for very low wages in very exploitative condition, and in fact right now not having any job at all. So I think this underinvestment in human resources has to be corrected. That's of course more than a short-term job. It will take time, but I think we have to learn from this experience. And in fact, it's interesting that the one state in India that has invested in human resources for a long time, namely Kerala, and therefore has much higher levels of education today, much longer life expectancy, a much better healthcare system. That is the state that is doing so much better now in terms of handling this crisis, and not just avoiding death, but also avoiding an authoritarian approach and having a much more participatory handling of the crisis, where people are empowered to fight the crisis together.
Yeah, all excellent points. I just hope that there is that shift in thinking that's required to make all of these things happen. Just want to summarize quickly that you're advocating for obviously releasing more food from center to state, making full use of the PDS. Some of the other policy recommendations are to expand NREGA immediately, or possibly transfer more money through NREGA. Social security pension schemes can be consolidated, expanded, but yet there will still be a significant number of people who fall by the wayside. And so another option that should be considered is to distribute food through, Anganwadi centers, kitchens, things like that, feeding programs, rely on existing feeding programs.
Not much about cash transfers. I'm also for
cash
transfers.
So I did want to ask you about cash transfers as well.
Well, this is one form of cash transfer.
Yeah,
but I think we can consider others as well. Although I'm not convinced that the current plan for cash transfers, namely the 500 rupees per month to women's Jan Dhan Yojana account, I'm not not at all convinced that this is the best thing that can be done. But I am in favor of some form of cash transfers, obviously, in this situation.
Yeah, I mean, you've written extensively on the limitations of cash transfers. Of course, there are advantages as well, but if you could just speak briefly about why you think cash transfers are not the be-all and end-all solution to the problem.
No, I'm very much in favor of cash transfers in this situation. Absolutely. We have to beware of the illusion that the infrastructure for cash transfers is in place. Unfortunately, it is not. There's a very patchy and inadequate cash transfer infrastructure. In fact, today I went to Latehar, the district capital in this district, not a very big town. And outside every bank, there were humongous crowds, like, at least 100 people outside the bank, outside each of the 4 bank branches that I saw, standing in the sun without any shade, right in the middle of the day. And that is before the lockdown relaxes. These are just the local people from Latehar town, not the people from the surrounding villages. So when the lockdown is relaxed or removed, people are going to start coming from the villages, and the crowding is going to be even worse. So we have to understand that the infrastructure of cash transfers is still very weak, and we have to be prepared to consider innovative cash dispersal schemes, like maybe even cash in hand, just giving people cash at the work sites or at the ration shops, because that's quick, and it spares people the hardships of going through the bank, and for that matter, it protects them from all the glitches in the current payment systems. So I think we have to be aware of that, and beware of the illusion that the so-called JAM, the Jandan Yojana Aadhaar Mobile Trinity, is there ready to be deployed for universal cash transfers. I think that's a pipe dream.
Great. So thanks very much for your time. Really, really informative. Really appreciate it.
Welcome.
Thanks.